Hey guys, DJ Health here with my good friend Captain Health. Today we are here to talk about breast cancer. The objectives of this presentation are to define cancer, specifically breast cancer, compare breast cancer to chronic disease, state the risk factors for breast cancer, state what are signs and symptoms of breast cancer, show the epidemiology of breast cancer, show how breast cancer manifests, show how complex breast cancer is, show how breast cancer is treated, show steps to prevent breast cancer, and an overall conclusion and summary of what was discussed beforehand. As this is necessary, as there will be 10 quiz questions during class time that you will need to look at the presentation in order to be able to answer. Cancer is a group of diseases characterized by abnormal cell growth which proliferates in an uncontrolled way with potential to metastasize. Cancer can affect almost any part of the body and has many subtypes. When cells grow old or become damaged, apoptosis occurs and new cells replace the old ones. In cancer, the genes for regulating cell growth in a cell become mutated or abnormal, allowing the cell to continue dividing without control. Abnormal cells do not die, and new cells form when they are not needed, forming growths called tumors. Breast cancer is just one of the many diseases known as cancer, which starts in the cells of the breast that can invade surrounding tissues or spread throughout the body. Breast cancer is most common in women and often begins in the cells that line the ducts of the breast called ductal carcinoma. Breast cells may also start in the cells of the lobules called lobular carcinoma. Both of these cancers can be in situ, meaning the location of the cancer is still in the originating location and has not spread to surrounding tissues. Breast cancer can also be invasive, meaning it has the ability to spread into surrounding tissues of the body. According to the Ministry of Health and Long-Term Care, chronic diseases are long-term diseases that develop slowly over time, often progressing in severity, and can often be controlled but rarely cured. Everyday physical and mental functions may be impaired, and the ability to perform daily living activities may be limited. Today, many cancers can be controlled and managed for long periods of time when a cure is not available. Many medical practitioners believe that being treated for cancer is considered to be a living with a chronic condition, or ongoing therapy is required for cancer patients and often involves treatment with medications that these patients can administer themselves, much like people with diabetes or high blood pressure. Risk factors for breast cancer can include a family history of breast cancer, rare genetic conditions, having dense breasts, BRCA gene mutation, atypical hyperplasia, and hormone replacement therapy could also result in breast cancer. Signs of breast cancer can include swelling of all or parts of the breast, skin irritation or dimpling, breast or nipple pain, nipple retraction, so turning inward, redness, scaliness or thickening of the nipple or breast skin, and nipple discharges other than breast milk. However, these symptoms may indicate cancer, but they could also indicate other possible chronic diseases. In Canada, women breast cancer accounts for approximately 26% of new cancer cases and 13% of all cancer deaths. It is estimated that 1 in 9 women will develop breast cancer during their lifetime and that 1 in 30 will die from it. An estimated 157,360 women were living with or surviving from breast cancer in 2009. 1 in 107 women were diagnosed with breast cancer at some point in 10 years prior to 2009. Most common type of breast cancer is ductal carcinoma, which accounts for approximately 90% of all in situ breast cancer carcinomas, 70% of all invasive breast carcinomas. The majority of breast cancers occur in females 50 to 69 years of age. 52% is what it accounts for. Approximately 30% of breast cancers are diagnosed in females age 70 and over, while 18% occur in females under the age of 50. In Canada, it is estimated that from 2016, 25,700 women were diagnosed with breast cancer. This represented 26% of all new cancer cases in women in 2016. 4,900 women would have died from breast cancer. This represents 13% of all cancer deaths in women in 2016. On average, 70 Canadian women would have been diagnosed with breast cancer every day. On average, 13 Canadian women would have died from breast cancer every day. And it is estimated that in 2016, 230 men would have been diagnosed with breast cancer, and 55 of them would have died as a result. Statistics seem to suggest that women get breast cancer more than males, and that when you compare the incident rates of both males and females, females is much higher than males, deaths is much higher than males, death rate is much higher than males, but over a 5-year net survival rate, females have a much higher chance than males, as females are more likely to develop breast cancer than males, and so there are better treatments to fight female breast cancer versus males. Trends in breast cancer. The breast cancer incidence rate in women in Canada rose through the early 1900s, but decreased in the early 2000s. This increase occurred partly because of mammography was used more often, which meant that more cases of breast cancer could be found. Another reason may have been increasing the use of hormone replacement therapy. In addition, the breast cancer death rate has been declining since the mid-1980s. This reduction in death rates likely reflects the impact of screening and improvements in treatment for breast cancer. A study conducted by Great Britain between 2005 and 2007 found that Canada ranked second in between 1 and 5 year survival rates of breast cancer patients. This suggests that Canada has a very good breast cancer treatment program and should continue to keep up the good work in their overall treatment of women or men with breast cancer. Based on a 2015 estimation of cancer deaths by gender, breast cancer was estimated to have caused 13.6% of all cancer-related deaths in women. This is the second leading cause of cancer-related deaths among women. In addition, even though the majority of new cases occurring in females under the age of 70, breast cancer deaths are lower. 48% of the total breast cancer deaths in this age group compared to females aged 70 and older. However, breast cancer represents a higher proportion of total female cancer deaths in the younger age groups, 22% of cancer deaths in 30 to 59-year-old women versus 12% of cancer deaths for women 60 and above. Prostate and breast cancers together account for 40% of all 10-year prevalent cancers. Breast cancer is the second most common type of cancer among Canadians.
There is much that we know and much that we have yet to understand. However, we do know that cancer spreads in 3 important ways. The first way being that damaged cells would replicate, creating more damaged cells and tumor growth. Number 2, being that hormones and chemicals can accelerate the growth of some tumors. And number 3, being that lymph and blood vessels can carry the cancer to other areas of the body, and lymph node examination can help pinpoint the progression of the disease. Healthy cells are the basic building blocks of all tissues and organs in the body. However, when cell DNA is damaged, mutated cells begin to rapidly reproduce without following the pre-wired plan. This causes aggressive cell growth that can form a tumor that does not function as intended. These abnormal cells, or groups of cells, can progress into the disease known as breast cancer, which can then spread to other parts of the body. The growth and spread of breast cancer can be difficult to grasp because cancer cell growth is often fueled by normally healthy chemicals of the body, such as estrogen, progesterone, and the HER2 new gene. Although each of these three bodily chemicals can serve an important healthy function, when a cell becomes cancerous, these chemicals can accelerate the growth of breast cancer tumors. Healthy HER2 receptors are proteins that help manage how a breast cell grows, divides, and repairs itself. However, in about a quarter of all breast cancer patients, the HER2 gene is not functioning properly. It makes an excess number of copies of itself in a process known as HER2 gene amplification. These extra genes then instruct the cells to make too many HER2 receptors, which is called HER2 protein overexpression. The result is that breast cancer grows and divides in an uncontrolled fashion. The lymph system, which is a part of the immune system, is a network of lymph vessels and lymph nodes running through the entire body. Similar to how the blood circulatory system distributes elements throughout the body, the lymph system transports disease-fighting cells and fluids. Clusters of bean-shaped lymph nodes are fixed in areas throughout the lymphatic system, as they act as filters by carrying abnormal cells away from healthy tissue. The type of breast cancer is generally determined by the origin of the growth of cancer cells, which is almost always in the lobes, lobules, or ducts. When cancer is found in nearby lymph nodes, it helps doctors identify just how far the cancer has spread. If the nearest nodes contain cancer, additional nodes are usually examined for the presence or absence of cancer cells to understand how far the disease has progressed. Breast cancer can be complex due to the presence of complex cysts, which consist of thick walls, thick septa, intracystic masses, or discrete solid compounds. Most common complex malignancies include ductal carcinoma in situ, also known as DCIS, and infiltrating ductal carcinoma. DCIS contains proliferated monomorphic neoplastic epithelial cells that fill the ductal lumina. Infiltrating ductal carcinoma can consist of granular or solid clusters of malignant tumor cells. The grading of breast cancer can go from stage 0 to stage 4. Stage 0 being that the cancer has not spread and is at an early stage, and stages 1 to 3 being that cancer has grown so large or has spread to nearby tissue, it may have also spread to lymph nodes. The higher the number, the more the cancer has spread and the more advanced it is. Finally, stage 4 means that the cancer has spread to other parts of the body. This is also known as metastasization. Cystic lesions are classified using the BI-RADS classification systems. BI-RADS stands for Breast Imaging Reporting and Data System. The first of these categories is a simple cyst. They are often described through their imperceptible wall, anechoic content, and posterior acoustic enhancement. Their BI-RADS is 2, and their PPV, also known as positive predictive value, which is the probability that a person with a positive test result has or will get the disease, of 0%. The second category is complicated cysts. They are described by their thin wall, echogenic content, fluid-to-fluid level, and posterior acoustic enhancement. Their BI-RADS is 3, and their PPV is less than 2%. The third category is the complex cystic mass. It is often described with a thick wall and septa, both exceeding 0.5 millimeters, an intracystic mass, and a solid cystic mass exceeding 50%. Its BI-RADS level is 4, and its PPV ranges from 2 to 95%. Complexity is also based on the type of breast cancer, of which there are many. Examples include ductal, mixed tumor, inflammatory, mucinous, and lobular breast cancer.
Surgery includes breast-conserving surgery, mastectomy, and lymph node surgeries. Surgery for breast cancer often depends mainly on the size of and the location of the tumor within the breast, the size of the breast, if the cancer has spread to other lymph nodes within the breast or through the body, or if you have already had treatments for breast cancer in the past. Radiation therapy for breast cancer is when external beams of radiation therapy uses a machine to direct radiation through the skin to the tumor and tissues surrounding it. Radiation therapy is almost always given after breast cancer surgery. In some cases, it may be given after a mastectomy. It is also used to treat breast cancer that has spread to bones, lungs, or brain, or other parts of the body. Hormonal therapy is often used to treat hormone receptor positive breast cancer. Postmenopausal women are given different hormonal therapy drugs than premenopausal women so that their treatment is unflawed and their recovery can be quicker. Chemotherapy is a common treatment for breast cancer. It is often given after surgery for early stage breast cancer to reduce the risk that the cancer will come back. It is also the main treatment for advanced or metastatic breast cancer. Combinations of chemotherapy drugs are most often used for breast cancer because they are more effective than single drugs and have a better chance of treating the different disabled cells within the body. Targeted therapy is a cancer treatment that uses drugs. However, it is different from traditional chemotherapy, as the drugs known as targeted therapy help stop cancer from growing and spreading. They work by targeting specific genes or proteins. These genes and proteins are found in cancer cells or cells related to cancer growth, like blood vessel cells. Follow-up care after cancer treatment is an important part of cancer care. People will need to have regular follow-up visits, especially in the first 5 years after cancer treatment has finished. These visits allow for healthcare professional teams to monitor the progress and recovery of your cancer treatment and to make sure the cancer is not coming back or is getting worse, should it have come back. Think of a receptor as a mouth. When open, cancer cells can feed and grow. When blocked off or closed, the same cells begin to starve. By identifying the cancer's unique receptors, doctors can recommend effective treatment methods to block the receptors. Remember, inhibiting the cancer's food supply works to restrict the cancer's growth. Ideally, cancer treatment plans will stop the cancer's growth before it spreads through the lymph system and on to other parts of the body, including its tissues and organs. Doctors recommend these 8 methods to helping prevent the development of breast cancer. These methods include keeping your weight in check, being physically active, eating fruits and vegetables and avoiding too much alcohol, avoiding smoking, breastfeed if possible, avoid taking birth control pills, particularly after the age of 35 or if you are currently smoking, avoid postmenopausal hormones, and take taxoneofen and raloxifene, especially if you're at high risk of developing breast cancer. Overall, chronic diseases are long-term medical conditions that are progressive. Cancer is a chronic disease because it involves having multiple risk factors and it has a long latency period. It is non-contagious, but it can be hereditary. It can lead to functional impairment and disability. It is non-curable, but can be made less severe or prolonged over time. Overall, we hope you enjoyed our presentation on breast cancer, and we hope you thought it was informative and gave you a new perspective of what breast cancer is and how it affects the women and men of Canada. We hope you have a wonderful day, and we'll see you all later.
Created using Powtoon.